With more Americans now testing for COVID-19 at home, it's become more difficult to monitor infection rates. That's why wastewater sampling is more valuable than ever, using sewage to track the pandemic. Michael George has more in today's Medical Minute.
These water samples come from sewer lines. What we flush down the drain could hold clues to the next surge of COVID-19.
It can be a sort of sentinel for what's coming up next.
The team here at the Columbia University Medical Center is studying how wastewater can detect new outbreaks, testing sewage from the hospital, research buildings, and nearby college dormitories. Because people with COVID-19 can shed the virus through their waste, the samples reveal infection trends within a community.
Anyone who has contributed to that wastewater is sort of tested at the same time. So it's like collecting one big pool of samples from a big population.
Just by analyzing the wastewater here, they can even detect what variants are emerging. These tests can function as a sort of early warning system. From California to Wisconsin to Florida, hundreds of communities are using the technique with full support from the CDC.
It's important for communities and health officials to use these measures to help inform prevention strategies for their local area.
Researcher Medini Annavajahla says the sampling can monitor for surges, even when the nation is ready to move on.
As testing of individual people ramps down, as the pandemic sort of comes to a different phase, we don't have the infrastructure anymore to test everyone, so wastewater is a great cost-effective way to do that at scale.
A canary in the coal mine to predict future dangers the pandemic may still have in store. Michael George, CBS News, New York.